Hello, and welcome to Bite Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Type II Hypersensitivity under the section of Immunology. So what is Type II hypersensitivity? It's an IgG or IgM antibody-mediated reaction. And as you recall, there are four types of hypersensitivity overall. Type 1 is an IgE mediated. Type 2 is an IgG or IgM antibody mediated, which is the topic of this session. Type 3 is an immune complex mediated, and type 4, which is a T cell mediated delayed hypersensitivity reaction. So in type 2 hypersensitivity, you have antibodies that bind to the cell surface antigens or extracellular matrix, which as a result will lead to cellular destruction, inflammation, as well as cellular dysfunction. So in terms of cellular destruction, the cell is normally opsonized by antibodies, which will then have phagocytosis and complement activation. Or you will have natural killer cell becoming activated, and as a result of that, you will have an antibody-dependent cellular cytotoxicity. The examples of this include autoimmune hemolytic anemia and transfusion reactions. As for the inflammation, it's due to the antibody, which, as we discussed earlier, is either IgG or IgM related, which binds to the cell surfaces. And as a result of this, you will have complement system activation and the Fc receptor mediated inflammation. The examples of this include Goodpasture syndrome, which is an anti-GBM antibody against alpha 3/4/5 scaffold of collagen 4, as well as in the case of rheumatic fever. With regard to the cellular dysfunction, you have antibody, which is, as previously mentioned, is either IgG or IgM, which binds to the cell surface receptors. And as a result of this, you will have abnormal blockade or activation of downstream process. And the examples of this include myasthenia gravis and pemphigus vulgaris, which is a condition that has antibody against the desmosome. So the investigations that you would really be keen to carry out in a case of a potential type 2 hypersensitivity reaction include basically investigating for any underlying cause or condition. And for that, I recommend you to have a look at our anaphylaxis and not allergy videos to find out about the correct way of investigating those conditions. You will also want to do a direct Coombs test, which basically detects antibodies attached directly to the surface of the red blood cells, and as well as an indirect Coombs test, which detects presence of unbound antibodies in the serum. Okay, so let's do some questions now. A 30-year-old female present to the clinic with fatigue and shortness of breath. She has recently had a viral respiratory infection. Laboratory investigation reveals a decreased hemoglobin level, and a peripheral blood smear shows evidence of hemolysis. Coombs test is positive for the presence of antibodies bound to red cell. What is the underlying pathogenesis of hemolysis in this patient? So the options that you have been given is A, immune complex deposition in the small blood vessels, B, activation of the complement cascade, C, cross-linking of IgE antibodies on mast cells, D, antibody-mediated destruction of red blood cells, E, granulomatous inflammation. So if you recall earlier, we talked about the fact that if the Coombs test is positive, this is most likely due to the antibody being picked up on the surface of red blood cell. And as a result of this, this is hinting at a type 2 hypersensitivity reaction. Therefore, the correct option in here is going to be option D. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.